Evolution of evidence-based nursing, from Florence Nightingale to present day. The concept of evidence-based nursing, EBN, has gained a lot of attention over the years, and it has become an essential part of nursing practice. Evidence-based practice, EBP, is a problem-solving approach to clinical practice that involves the conscientious use of the best available evidence in combination with a clinician's expertise, patient preferences, and clinical context. EBN is the application of this approach to nursing care. The evolution of EBN has been a long and ongoing process that has seen nursing practice move from being based on tradition and personal experience to a more scientific and evidence-based approach. This article will provide an overview of the evolution of evidence-based nursing from Florence Nightingale to present day. Florence Nightingale, the mother of evidence-based nursing. Florence Nightingale is widely regarded as the founder of modern nursing, and her work laid the foundation for evidence-based nursing. Nightingale's approach to nursing was based on observation, measurement, and analysis of patient outcomes. She used statistical methods to analyze patient data and track the progress of patients under her care. Nightingale believed that nursing practice should be based on scientific principles and that nurses should be trained in scientific methods. In her book, Notes on Nursing, Nightingale emphasized the importance of collecting data to inform nursing practice. She believed that nurses should keep accurate records of patient care and outcomes and use this data to evaluate the effectiveness of nursing interventions. Nightingale also recognized the importance of patient-centered care, and she believed that nursing care should be tailored to meet the unique needs of each patient. Despite Nightingale's emphasis on evidence-based nursing, nursing practice remained largely based on tradition and personal experience for many years. It was not until the mid-20th century that the concept of evidence-based nursing began to gain momentum. The emergence of evidence-based nursing. In the mid-20th century, advances in medical research led to an increased focus on evidence-based practice in medicine. The development of randomized controlled trials, RCTs, and other research methods made it possible to evaluate the effectiveness of medical interventions more rigorously. As a result, evidence-based medicine, EBM, emerged as a new approach to clinical practice that emphasized the use of the best available evidence to inform medical decision-making. Nurses began to recognize the value of evidence-based practice and the need to incorporate research findings into nursing care. In 1972, the American Nurses Association, ANA, established a nursing research committee to promote nursing research and encourage the use of research findings in nursing practice. This marked the beginning of a new era in nursing practice, one that was based on evidence and scientific principles. In the 1980s and 1990s, nursing researchers began to develop evidence-based guidelines for nursing practice. These guidelines were based on the best available evidence and were designed to help nurses make informed decisions about patient care. One of the first evidence-based guidelines developed for nursing practice was the Pressure Ulcer Prevention and Treatment Clinical Practice Guideline, which was published in 1992 by the Agency for Healthcare Policy and Research, now the Agency for Healthcare Research and Quality. The Cochrane Collaboration, an international network of researchers, was also established in the 1990s to promote evidence-based practice in healthcare. The Cochrane Collaboration produces systematic reviews of healthcare interventions and provides healthcare professionals with evidence-based recommendations for practice. Integration of evidence-based nursing into nursing education. The integration of evidence-based nursing into nursing education has been an important factor in the evolution of EBN. In the past, nursing education focused primarily on teaching practical skills and clinical judgment. However, with the emergence of evidence-based practice, nursing education has evolved to include a greater emphasis on research and evidence-based practice. In the late 1990s and early 2000s, nursing schools began to incorporate evidence-based nursing into their curricula. This included teaching students how to search for and evaluate research evidence and how to apply evidence-based guidelines to patient care. Today, evidence-based nursing is an essential component of nursing education, and many nursing programs require students to complete courses in evidence-based practice. Impact of evidence-based nursing on patient care. Evidence-based nursing has had a significant impact on patient care. By incorporating the best available evidence into nursing practice, nurses are able to provide high-quality, patient-centered care that is based on scientific principles. Evidence-based nursing has been shown to improve patient outcomes and reduce healthcare costs. One example of the impact of evidence-based nursing is the use of evidence-based guidelines for pressure ulcer prevention and treatment. These guidelines have been shown to reduce the incidence of pressure ulcers and improve patient outcomes. Another example is the use of evidence-based guidelines for the prevention of central line-associated bloodstream infections, CLABSIs. These guidelines have been shown to reduce the incidence of CLABSIs and improve patient outcomes. In addition to improving patient outcomes, evidence-based nursing has also been shown to improve nursing practice. By using evidence-based guidelines and practices, nurses are able to provide care that is consistent with the best available evidence, which can increase job satisfaction and reduce burnout. Challenges and limitations of evidence-based nursing. Despite the many benefits of evidence-based nursing, there are also challenges and limitations to its implementation. One challenge is the availability of research evidence. Not all clinical questions have been studied, and there may be a lack of high-quality research evidence available for some clinical questions. Another challenge is the complexity of implementing evidence-based practices in clinical settings. Implementing evidence-based practices requires changes in organizational culture, workflows, and clinical processes, which can be challenging to achieve. There are also limitations to the use of evidence-based nursing. Evidence-based guidelines and practices are based on research evidence, which may not always be applicable to individual patients. Clinical judgment and patient preferences must also be taken into account when making clinical decisions. Evidence-based nursing has come a long way since the time of Florence Nightingale. Today, evidence-based nursing is an essential component of nursing practice, and it has been shown to improve patient outcomes and nursing practice. The integration of evidence-based nursing into nursing education has been an important factor in the evolution of EBN. Despite the challenges and limitations of evidence-based nursing, it remains an essential component of nursing practice and will continue to evolve as new research evidence becomes available.